Over the past 2 decades, the U.S. has made extraordinary progress in the fight against AIDS. And experts say that this has happened in large part because of President George W. Bush's emergency plan for AIDS relief. It was called PEPFAR. It's a program that has cost more than $100 billion, but it has saved more than 25 million lives. AIDS-related fatalities are now down 68% since their peak back in 2004. PEPFAR is the largest commitment of any country ever to fight a single disease, and it is now up for reauthorization by Congress this year. Dr. Deborah Birx led the implementation of PEPFAR programs as U.S. Global AIDS Coordinator. You'll also remember her as the Coronavirus Response Coordinator in the first year of the COVID pandemic. She is now a senior fellow at the George W. Bush Institute. Dr. Birx, good morning to you. Thank you very much for being here. With advancements in science and medicine, a diagnosis, an AIDS diagnosis, is no longer a death sentence. And yet you say we still need to prioritize this fight. Why do you say that?
Well, for 2 reasons, and I think your lead-in from the California story is such a great lead-in because it shows that compassion by individuals changed the life of an individual. And how did it change? Because they acted. They didn't just talk about it, they actually acted and saw the total needs of that individual. And that's what PEPFAR was about. It's about seeing the total needs of the pandemic and responding in a comprehensive way. And this is the first time that the U.S. translated money and people into an act of compassion. And we have shown that you can change the course of a pandemic. And I think that's what gave me hope and still gives me hope today, that we can continue to change courses of pandemics around the world.
Dr. Birx, when it comes to the reauthorization of PEPFAR, do you believe that our political climate is strong enough to push through an initiative like this right now?
Well, what PEPFAR taught us is if you want to do something big, as President Biden just said in recognizing 20 years of PEPFAR, and there's a live stream today starting at 9 o'clock from the Bush Institute that really goes through what PEPFAR has done. But when President Biden can talk about an initiative done by a Republican president with respect, that's how we work to do big things as a country, whether it's domestically or globally. And so, yes, I think there will be reauthorization because I think Congress, we've done this through 11 Congresses with excellent support. But I think as a country, we have to understand if you want to do something big, if you want to do something that has an impact that transcends political parties, you have to work in a bipartisan way. And that's why I know PEPFAR will be reauthorized.
Dr. Birx, just baseline it for us. Where are we in the fight? And 2, I know there is a goal to end the threat of AIDS by 2030. So how will we get there, considering where we are now?
Well, it's as you said in the lead-in, you use science and technology, but most importantly, you use granular data on the ground, where you treat every new infection as a failure of your programming. And when you do that, and you see the individuals that are impacted and acquire HIV, then you put programs in place that prevent those new acquisitions of infections. And that has been enormously successful. But for every success that you have with a population or a community, you can see the individuals you've left behind. And that is absolutely critical. I wish we were doing that today with COVID, treating these 300 to 500 deaths a day as a failure of our programming, because when you do that, you see what the issues are and you fix them.
Dr. Birx, I want to shift altitude here, kind of pull back and talk about trust and faith in science in general, because the COVID pandemic has certainly taught us that people lack both of those things in this country. And I'm curious what you think needs to be done to restore them.
I think you have to get into the community. You cannot sit in Washington or Atlanta and just put up commercials and public service announcements. You need to get into the community and really hear from them and listen to them, just like you did with the California case. You listened to what his needs were and you addressed his needs. We're not addressing the needs of the communities that are maximally impacted with COVID, and we're not addressing those that are at significant risk even today. We're not addressing the issues of tribal nations and our rural communities and our disenfranchised individuals. Instead, we're just reassuring ourselves that they're not listening. That's our job as public health officials, to get on the ground and figure out what we're doing wrong and fix it. You cannot do it from Washington or Atlanta.
But as Tony mentioned, the COVID pandemic, White House announced that the COVID-related public health emergency declarations will expire in May. Is that the right call?
Well, you have to look what we're losing and what was going to be put in its place. And I think what's important is we have to get into the communities that are still dying. We've lost already about 5% of Americans over 65. We've lost 1.1 million Americans. I don't consider that a success. If that was happening with PEPFAR, we would consider that a crisis, and we would work to fix it. And that's why today, with the disenfranchised groups that still exist around the world, we need to improve our policies and our human rights to ensure that we're reaching everyone. That applies globally, and it applies here in the United States. So despite the ending of the emergency, we need to dig in and do the hard community work to ensure we bring people back to the table.
Yeah, Dr. Birx, we got to leave it there for now. As the 2024 campaign heats up, though, we will, of course, be relitigating a lot of what happened during the COVID pandemic through a political lens. So we'll talk more then, I'm sure. Thank you for being here.
Thank you.